According to the World Health Organization, primary healthcare is vital to meeting the majority of people's health needs throughout their lifetime. Primary healthcare is a provision of basic essential services which includes preventive, promotive, curative, and rehabilitative services. It serves as the first point of access to healthcare by individuals, families, and communities, bringing health services as close as possible to homes and workplaces, and has thus been described as the bedrock of universal health coverage. In Nigeria, primary healthcare services are delivered by PHC centers, basic healthcare clinics, and comprehensive health centers, with over 30,000 of these facilities spread across 9,565 wards in 774 local government areas. With oversight by the local government authorities, the majority of these facilities are in the rural, underserved, and hard-to-reach areas to ensure improved equity and access to health services. Unfortunately, only about 20% of these 30,000 PHC facilities are functioning across Nigeria. Most of the functioning facilities cannot provide essential health services due to poor staffing, inadequate equipment, and poor condition of infrastructure. In a first of its kind Health System Sustainability Index report released in 2021, Nigeria ranked 14th out of 18 African countries, scoring 41 out of 100. The English report also disclosed that Nigeria scored as low as 31 out of 100 when it comes to health access, which speaks huge volumes as how primary healthcare is delivered in the country. The deplorable state of Nigeria's primary healthcare is taking a toll on public health as vaccine-preventable infectious and parasitic diseases are causing high mortality and sicknesses. Amazingly, malaria, a curable disease, is still responsible for about 11% of maternal deaths, 25% of infant mortality. Data from the Nigerian Demographic and Health Survey 2018 shows that 31% of children aged 12 to 23 months received all basic vaccinations, meaning they got at least one shot, but the same data shows that about 70% of children did not get a complete dose of vaccine. Primary healthcare services suffer from a lot of challenges. However, the lack of adequate funding tends to be a key factor that hampers quality healthcare delivery in Nigeria. Healthcare funding in Nigeria has always been less than 5%, which is not in accordance with the Abuja Declaration, where several countries, including Nigeria, committed to set a target of earmarking at least 15% of their annual budget to health. In 2021, the federal government's health budget for the entire country was 547 billion naira, approximately $1 billion, which is less than half the $2.4 billion expenditure budget for Guy's and St. Thomas, a single government hospital in the UK, favored by most Nigeria's ruling elite. Apart from poor budgeting for healthcare, there is also evidence of erratic or lack of release of allocated budgets. In 2011, it was recorded that out of 63.4 billion naira budgeted for health at the federal level, only about 26 billion naira, less than half, was utilized. This is affecting expenditures and leading to significantly poor implementation of health program activities. Furthermore, there is a shortage of health workers in Nigeria due to a massive brain drain as medical practitioners continue to relocate outside the country in search of better working conditions. Nigeria already has a very low doctor-patient ratio at 4 doctors to 10,000 patients, which is not in accordance with the WHO standard at 1 to 600. It is estimated that at least 2,000 medical doctors leave Nigeria annually, and no fewer than 5,000 Nigerian trained doctors are currently working with the British National Health Service. A representative from the Nigerian Medical Association has noted that more than 75,000 Nigerian doctors are registered in the association. However, more than 35,000 have already left the country. Despite the shortcomings of the Nigerian primary healthcare system, it has, however, recorded some successes in addressing major public health issues, such as the successful eradication of polio in Nigeria through effective vaccination programs. Nigeria has also tried to address the issue of poor funding by enacting the 2014 National Health Act, which is meant to establish a basic health provision fund financed predominantly through 1% of the Consolidated Revenue Fund. In 2018, the Nigeria Senate approved a sum of 57.15 billion naira, but available evidence suggests that the fund is still inadequate for PHC financing. Health experts argue that healthcare delivery will continue to struggle under a poor primary healthcare system riddled with inefficiencies and negligence. Therefore, a lot has to be done by the government to improve primary health. For starters, significantly boosting funding for PHCs, which will have tremendous positive impacts. It will also be important for the government to put in place measures to curb misuse of these funds to ensure optimal efficiency. According to the Alma Mater Declaration, access to primary healthcare is a fundamental human right. Therefore, the government has the responsibility to ensure it is available to everyone, especially to vulnerable groups like low-income communities who would often not be able to afford quality health care.